Oh, hello, how do you do? And good afternoon. I'm a bit dressed up today because I've just been participating in an informal meeting of diplomats in New York, looking at how, firstly, they can work better together on responding to this current COVID crisis, but also organize to be better defended against future potential pandemics. It was interesting because actually I've been working on these kinds of issues really since 2005 when I was involved in avian influenza. Quite a big scare that was. And then 2009 on an influenza pandemic caused by the virus H1N1. And then 2014 working on Ebola in West Africa. And then in 2016 involved in the cholera outbreaks in Haiti. So I kind of felt that I had a little bit of experience to share. And it was interesting to see just how motivated these diplomats are to try to work together. They were from a number of countries, including United States was there, China was there, and others as well. So, you know, you keep kind of keeping your fingers crossed and hoping that we're going to be able to get better cooperation between governments dealing with this particular crisis. And I think one of the challenges, of course, is when you're in the middle of a crisis that's advancing at huge speed, it's quite difficult to actually realize what's actually happening around the world because so much is going on. And I'm still wondering just how much people do understand the intensity and depth of the challenges associated with COVID. I mean, one of the points I had to make, I wonder what you think about this, is we're still possibly at early stages of dealing with this virus because we're dealing with the current big outbreaks all over the world, and they're growing in many different parts of the world, not all, but at the same time, we're having to get ready for having COVID around with us for the foreseeable future. And I was saying it'll be 18 months until there's a vaccine that's being tested, but it'll take some time to administer it. And these are optimistic dates, you know, vaccine ready possibly by 18 months' time. So that's towards the end of 2021. But then actually administering it to 7.8 billion people, not all of whom will necessarily want to be receiving the vaccine. And it might be quite complicated if it needs to be kept cold and given by injection. Well, that takes a good year. It's not something that you just do just like that. We've seen that with so many other campaigns, polio, smallpox and the like. So I keep reminding people, hey, we're going to have to live with this virus for 2.5 years. And while some countries have shown that you can actually suppress outbreaks of COVID and actually be COVID free, if you work really, really hard and intensively, New Zealand's doing really well. Alaska, which is a state in the US, is doing really well. Haiti is doing Hawaii is doing really well. And then we've got Greece that's got some very good reports coming through. So that, you know, that is doable, but the reality is that many other countries, particularly those that were a bit slow to get on top of the virus, slow to contain it when it's first arrived, they're the ones that have got more troubles. I want to particularly talk about Nepal, great country where I've lived for a long time, and I'm very pleased that we have colleagues from Nepal here. There, the challenge is that you've got an open border with another country where there's a lot of virus. And so even if you do an enormous amount to try to protect your people, you've still got people with COVID coming in. And so what we always have to remember is that it is about being defended against the virus, being COVID ready. That's the key, and it's tough. And so today, what I want to do with you all is to actually revise for you some of the elements of being COVID ready that are really, really important. And the reason why I'm doing this is that there are a number of countries all over the world where there is a bit of a dilemma. Here's the situation. When we started having our COVID, they say, we did our best to try to hold it back and to defend ourselves against the outbreaks and the virus. But over time, we got quite a lot of cases, and so we imposed movement restrictions with a lot of physical distancing, something that people call a lockdown. Personally, I don't like the term lockdown. I prefer to say movement restriction, but in fact, it does actually also mean people staying in their residences. It means that quite a lot of economic activity is stopped. And as I've said before, really over the last month, around half the world has been in lockdown. It's the most extraordinary phenomenon, never ever known before. And of course, a lockdown restricts movement. It stops the virus transmitting so fast. It really reduces the amount of time for an outbreak to double in size. But it also increases unemployment, poverty, restricts access to food and nutrition, which I'm going to talk about in a minute. And it really does create problems. In some countries, you hear governments say, well, perhaps we have to choose between the virus and the health consequences or the consequences of lockdown. And you hear these debates that actually people say, well, perhaps it's just easier if we let the virus just go and flow and affect people, because the lockdown just causes so much suffering and so much poverty, malnutrition, probably also death because health services break. But I'm going to say to you, as I said to these diplomats just now, we must get the narrative right. The way in which you sustain your economy, the way in which you sustain employment, the way in which you sustain social life is making sure that you can defend yourself against this virus, holding it back, stopping it from coming in, stopping it from being transmitted, stopping health services from being overwhelmed. And I think that that experience is being listened to by many, many countries. Conversations today with colleagues in India reminding me that, yeah, they are putting really robust community level defenses in place, not everywhere, trying to actually stop the spread of the disease. My conversation with Rajan in Nepal, that's what they're trying to do there. My conversations with colleagues in West Africa and East Africa and Southern Africa, what they're doing, saying, just welcome Abdoulaye Carr, welcome, so delighted you're here. Great to see you, sir. Merci, bienvenue. C'est magnifique que vous êtes ici. And so actually many, many poorer countries are doing an enormous amount to get on top and get ahead of this virus. And they're using the lockdown as a time to get their services built up. And that is just great. But yeah, the lockdowns hurt. So let's just think about some of the things that might be considered by governments, whether they're local governments or national governments, as they're trying to decide, should we be reducing our lockdown? Should we be easing things up? Desperately they want to, because people are short of food. And people are finding the unemployment that comes from a lockdown, especially if they're in the informal economy, absolutely desperate. And so, what would we like to suggest if you're thinking about removing a lockdown? And so we've developed this language that some of you will know of, not all, because some of you are new. We've developed this language of something called the COVID-ready state. And if you want just a quick teaser about the COVID-ready state, if you go onto our website, the 4SD, you will find a little video that's been produced by our colleague Derek Owen and his team that our friend Twee put together, which is actually giving a little summary of the COVID-ready state. And we're just in the middle of producing another video about the COVID-ready state that's specially designed for people who are working in places where resources are a bit tight. So what are our points about this? Well, firstly, we'd like to remind everybody, virus, slightly over 5 months old. And it's new. It's new for everyone. And it's a totally new virus. It's a new coronavirus. Coronaviruses are really tricky. We've known that for ever since, certainly I've been doing medicine, watch the coronavirus, as people say. And it's really so new that everyone in the world is trying to work out what this virus means. And you have to remember, many people even know what a virus is. You know, it has no independent existence. A virus is a tiny bit, in this case, of ribonucleic acid in a band. with a membrane around it and a few little things inside it, but it has no independent existence at all. It's only viable inside another living creature. And we're really interested in what this virus does inside humans. And so this virus is only viable inside humans. And when it gets into humans, it reproduces like mad, and it causes quite a lot of discomfort, and it damages the body, and it multiplies and multiplies and multiplies, and then irritates, particularly in the upper part of the chest, and then people cough, and then it's transmitted to another person. And this virus, being new and only living inside people, only survives through being transmitted from person to person to person to person. And our job is to understand this virus, to know its habits, but most importantly, to stop it being transmitted from person to person. So everyone is trying to work out what this means. Everybody's trying to understand it. And that's a massive sense-making process for all 7.8 billion people on our planet. And so the COVID context rapidly changing, the virus is new for everyone, we're all trying to make sense of it. That's my starting point for when I talk about the COVID-ready world. Second point about COVID-ready world is the virus is not going to go away until we have a vaccine, because that's the way we can actually eradicate this virus, is by everybody being immunized so that the virus can't infect anybody at all. Now that is quite a tough task. That is, as I said, minimum of 2.5 years, maybe longer. So we've got to learn to live with it. Got to learn to live with it as a threat. And that living with it as a threat means holding it at bay. And it will infect some people, and they will have had it. And we hope that they will be immune so they won't get it again. So they'll be very fortunate people, but actually having this virus is not good for you. While some people get quite mild illness, we're finding masses of evidence that suggests that as well as older people and people with associated disease have high risks of something bad happening, that it also is not very nice for people who are younger who get it. It makes them quite ill for quite a long time. And we're learning that this is a virus we've really got to hold at bay. So we've got to learn to live with it in a way that keeps it away from as many people as possible. And the third basic starting point is this. Outbreaks of this virus start with a person who's got the illness. That person then passes it on to another person, probably altogether 3 or 4 people on average during their illness. And then each of them pass it on to 3 or 4 people. And outbreaks start small, but they grow big super fast. Please try to remember this. It's something called exponential spread. If you're interested in graphs and so on, it's a graph that goes up in a nice bendy line, like that. Or exponential, it's called. Exponential. And so an outbreak grows 8 times in the first week, 40 times in the second week, 300 times in the third week, 1,000 times in the fourth week, and then it's 20,000 times by the 5th week, and then it's 100,000 times bigger in the 6th week. If you do not act very quickly to suppress an outbreak of COVID as it builds up, and there's only just 1, 2 or 3 or 4 people infected, you might just suddenly find it, suddenly you've got a few people ill. If you don't stop them quickly from transmitting it to others, your outbreaks build up fast. And we see how that happens because basically the New York outbreak, which has been huge, built up over a period of about 4 or 5 weeks before there's really intensive action by movement restriction to stop it spreading. And then zoom, it's coming down, coming down, coming down, coming down, coming down. But the longer you wait when an outbreak is building up, the harder it is to bring it down. And so the countries that have really been very dramatic and very quick and have suppressed their outbreaks fast are beginning to look at each other and say, well, okay, we showed it can be done. Because they did it so quickly. So, you know, Greece, Germany, until recently, they just had a bit of a spike. Austria, Czech Republic, Singapore, but they've had a bit of a spike. And New Zealand, you know, these are countries that have kept it down. But if you don't act quickly to bring it down, then you're stuck with asking yourself, what's going on? You've got more and more people turning up in hospital, more and more people needing care, more and more health workers just totally exhausted, more and more virus around, so they're getting ill, more and more old people really worried. It's that ability to stop them quickly that matters so much. But we're talking here about really fast. Find a person with COVID, you have to make sure they isolate and can't transmit it to anybody else immediately. Not waiting around for 3 or 4 days for a test result, but immediately isolate, immediately find their contact. So outbreaks start small, but they build up very quickly. So now I'm going to come to what I'm going to call the 9 principles for being COVID ready. These are mine, but they're based on the World Health Organization. They've been developed by our team. I'll tell you about our team in a minute. The first 3 principles are about people. People themselves are able to interrupt transmission and limit outbreaks through the way they behave. I really want to be clear, it's about people, because I think what we've learned from all the countries where COVID outbreaks are happening is that people themselves, through their behavior, make a difference. And the simplest thing, as you all know, is that we have to keep a bit apart from each other. Physical distancing. Please don't call it social distancing, physical distancing. And the ideal physical distance, if you could possibly manage it, is more than 6 feet or 2 meters. I know that doesn't exact, but might as well stick with the approximation. Limit transmission with physical distancing. And I want to stress this, and I'm going to see if I can find one to show you. Ideally, wear face protection. Because if I happen to have COVID and another person does not have COVID, if I put a protection over my face, I can stop my droplets from going to that person. I can stop myself from infecting that person. And when I'm talking about face protection, I don't mean a fancy medical mask. I mean something simple that's made, probably from a pattern. Here's mine. Very simple. Cover your nose, cover your mouth, make sure it's snug fitting so there's not a lot of space here. Make sure the elastic bands are tight but hold it around your mouth. Learn to smile with your eyes. We're going to get all sorts of ways of communicating with our eyes, with our upper face, with our ears perhaps. I can't move my ears. But it's very, very important to be able to be comfortable wearing a mask. There are a lot of people who feel that wearing a mask makes you scary. It's easy for me wearing a mask because I used to wear them when I was doing a lot of clinical work. A lot of other people are pretty scared. So wear a mask, wear it well. Don't touch your face all the time while you're wearing it. If it gets wet, take it off and put on another mask and wash it well. So face protection as well as physical distancing is important, because especially if you can't maintain the physical distancing all the time, face masking is super important. And then the third part of it is hygiene, hand washing, super often, because an awful lot of the time we transmit saliva into our mouths from other people because we get stuff on our hands, and our hands are the most remarkable way to move things. And so because a lot of us, people like me in particular, are always touching our face with our hands, we have to be very careful about hand washing and hand hygiene, surface cleaning, and all the rest. So my point 1 about people is physical distancing, face protection, if you like face masking, it's still not an agreed term, and hygiene. Please make sure that you use that combination. Part 2 about people is make sure that anybody who's got symptoms that might be COVID actually isolates themselves quickly and isolates themselves rigorously. I can't be too emphatic about this, that as soon as you have the symptoms, get out the way. Get out the way. Don't be talking to people. Don't be breathing on people. And even if you're not sure, isolate yourself. Much better. And for quite a lot of people, that unsureness is a big deal, because for many of us, COVID symptoms are super mild. And I just got this friend, you know, who's got a daughter who's in her teens, and she's had a cough and she's been a bit unwell. And she's not sure whether she's got COVID, but eventually, after discussion between mum and daughter, they agreed that daughter would isolate, even though the symptoms weren't quite right. I think that's the only thing you can do. So limit transmission through isolation, and then immediately shelter in your place, and make sure that all the contacts with whom you've been in touch since you started your illness also shelter in their place, because it's that capacity to isolate ourselves and be away from others. Sheltering in place is a very fancy way of putting it. And also getting our contacts to do that. That's the absolute key. That's the basis of interrupting transmission. And by the way, at all times, make sure that those who are particularly vulnerable, my age bracket perhaps, or people who've got other illnesses, just protect them, shield them. Don't isolate them, but protect them from contact with others who might have COVID. So those three things are people things. Number one, physical distancing, hand washing, and face protection. Number two, rapid identification of your symptoms, isolation, and also finding the contacts and get them to isolate. And number three, actually make sure that those who are vulnerable are shielded so that they don't get ill as well. Now let's think about places. Let's think about the places where we are. I've got three points on places. First of all, if there is an outbreak and it's a significant one and it's growing, that's when you have to stop movement. And I want to be clear, stop movement, because that's the quickest way that you can prevent an outbreak from growing big. You stop people moving. And actually in COVID ready, in the new state that we're all going to be in, we're going to have to be ready from time to time for a sudden announcement to come out. Can't move, stay put. So we might have been planning to go to the shops, or we might have been planning to go to the office, or we might have been planning to go and see our friends. No, we won't be able to move. And it's going to create quite an interesting challenge, but we've got to be ready for that. The capacity to stop movement when there's an outbreak is going to be a key part of the COVID ready state. And then, once you've got that, you must make sure that to support that, you've got the capacity test, so that in that place, there are enough tests around so that those who've got the disease, when you're trying to suppress an outbreak, they're identified quickly. And then you can actually really tell them for sure, you must isolate. We've done a test on you. So you support the behavior of people who get in the habit of isolating when they've got symptoms with the nice test. And I'm part of a group that's really trying to encourage the arrival of new tests, but super simple, a bit like a pregnancy test perhaps, where you put a swab of saliva onto the stick, and then within a few minutes you can find out, have you got the virus? This is a virus test. It's a very simple one. We're not there, as you know. Tests are currently a big issue in many countries, so we're trying to develop new tests. And then I want to come back to the place has got to be designed so that isolation is possible, and that particularly the vulnerable people can be isolated as well. I was just again talking to my friend whose daughter has needed to isolate, and I said, have you got space in your home? And she said, well, we're lucky. We've got a spare room, actually with its own bathroom, where our daughter can isolate. But just imagine the challenge of isolating and protecting people who are vulnerable in a home where you might have COVID, and shielding them when you don't have good facilities. So we're going to have to find ways of shielding vulnerable people from those who might have COVID, or even from the more general population if we think there's a lot of virus around, of shielding vulnerable people without them feeling isolated. And this is going to get very, very important. This is the characteristics of places. Now, just for a second, I want to divert here because I've been talking to a lot of people working in places where it's hard for people to isolate. Just imagine you're a migrant laborer and you've been put up in a dormitory, and the dormitory has 12 people to a room and there's not good ventilation. And gosh, somebody's got COVID. Wow, very, very hard indeed to isolate in these communal dwellings. Imagine you're an older person in a residential home for old people. Again, it's super hard to be able to isolate there. Or imagine you're living in a very overcrowded slum or a favela or a township. Very hard to isolate there. So I actually believe that in the COVID-ready world, we're going to have new standards for living that make it possible for people to be physically distant from each other and, if necessary, to isolate. I mean, talking to people, designing new capacities in businesses where they're going to set up isolation rooms in their businesses so that people, if they think they've got COVID, can get away from others. There's a huge amount of work that there need to be done by architects to find better ways of creating space where people can, if necessary, isolate. Now, just last three is some principles for what I'd like to be operating. How I'd like to be putting this forward. First of all, the principles are universal. Universal. It's not going to be different for Bombay or for Brighton. It's not going to be different for Baghdad or for Buenos Aires. It's going to be the same. It's really, really important, this. The principles of people's behavior, the principles of the place and the capacity of the place for being able to test when necessary, the capacity of the place for people to be able to isolate, that is going to become a universal thing. And secondly, on the principles, everybody who's getting used to this way of living and working is going to have to be able to talk about it because it's the most enormous behavior change. Everybody. And we've got to make sense of it. I talk with my family each week. Florence, my wife, she talks with her family. Not quite each week, but it's coming. And the conversations are really important because we're all having to think through, what will this mean for me? But we need a global conversation. What does it mean for us? What does it mean for humanity to be changing our behavior in ways that are COVID ready? And we'll have to be making these behavior changes that will last for a number of years. It's not suddenly going to go back. And it will mean real challenges. Yeah, we will be needing to wear masks when we're in public, when we're on public transport. We will. Otherwise, we're endangering each other. We will be able to needing to wear masks when we work very closely together. Otherwise, we're endangering each other. And then thirdly, we're going to have to learn as we go. This is a new virus. I started at the beginning. And we're learning the practices. And we are going to become a massive global learning community. I mean, we are already, but it's going to become a most profound collective learning experience. So let me just share with you again, very quickly, the revising here, the 3 points at the beginning. The virus is new, and we're all trying to work out what it means. The virus is not going away. Everybody's learning to live with it. Outbreaks start small, but they build up very quickly. We're going to limit transmission through physical distancing and face marking and hygiene. We're going to limit transmission through rapid identification of symptoms and getting ourselves out of the way. We're going to limit transmission indeed by staying in the place where we are. We're going to suppress outbreaks fast when they start by stopping movement where they're occurring. We're going to quickly detect the localities where there are outbreaks by testing where possible, tracing contacts, and being very clear that you've got to get out the way and isolate. And we're going to protect the most vulnerable. We're going to shield them. Older people, people working in closely confined areas, overcrowded workplaces. And we're going to make this a new characteristic of the future, and we're going to be able to improve workplaces so they're not so crowded, I hope. We're going to have a recognition that this is universal, not just one set of rules for the rich and one set of rules for the poor, not just one set of rules for the North and one set of rules for the South. This is universal. And we're going to make certain that if there is some kind of movement restriction, that people can be supported. These principles require dialogue and engagement with everyone affected. Everyone, consult. Don't impose some rules without consultation. We can learn rapidly as we go. That matters so much. This last point a bit about movement restriction. Yeah, what's happening is all over the world, people are being invited to stop moving, and in some cases governments are saying stop, and it's tough. For an awful lot of people, particularly people in the informal economy, people on daily wages, suddenly their income has just dropped. And they are feeling the pinch. They are hungry. Their kids are hungry. They can't get the medicines they need. They're really fed up. And so it's absolutely essential that we recognize that containing COVID is leading to a massive challenge of food insecurity and malnutrition. So today, something called the Global Nutrition Report has been released, which talks about world malnutrition, and it really identifies the challenge of increasing malnutrition, particularly among women and children, as a result of COVID and its containment. Any of you who are interested, please let us know. I'll ask whether we can type the Global Nutrition Report coordinates into the chat line, but we'll certainly put it up on the website later today. This Global Nutrition Report has a foreword, which is really a call to action about COVID and its containment and the possibility of increases in levels of malnutrition among children. I'm really worried about this. Some of you know that working on nutrition has been right at the center of my life, and in fact, the center of the life of many of ours in 4SD for many years. So please, 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 let's not let responding to COVID, the horrors of COVID, actually precipitate an increase in levels of malnutrition among children. We're going to have discussions in the movement for scaling up nutrition about this. And I just wanted to mention that today, this Global Nutrition Report has got quite a detailed foreword at the beginning that talks about COVID and malnutrition, and it's just been released today. Huh? Okay, I was just getting a message, but if I've said anything wrong, you'll tell me. Right, so that's my opening remarks, and I just want to say how much I'm happy that we continue with these briefings. I feel they are just a wonderful opportunity for us to share our thinking, and through your questions and the answers we give, we advance our thinking, because after each of these sessions, our team gets together and we reflect on what's happened. But we also have decided that wherever possible, we'd like very much to have opportunities for some of you to make short remarks. So if you do want to say a word or two while this is going on, please put a message in the chat thing and we'll find a way to make it possible. Only a couple of sentences, because otherwise it gets all complicated. And technical stuff, as some of you who were here on the last one, you'll realize that it doesn't always work. But there are one or two people on the briefing today who've not been on previous briefings, and I really want to greet you all. And at the end, I'll try to have some little exchanges with you if we can possibly make it. So thank you all for time to join. Our friend Catherine Cunningham has joined. I have to, by the way, when I'm doing this, try to watch the little light at the top of the computer. So I can't watch the screen, but just say hello to Catherine, say hello to Christina, say hello to Sarah, Kathy, Harriet, Abdullah Khan, as I've just mentioned, Paul, Yvonne, Lucky, Carlos, all of you, thank you for being with us. Our team in 4SD is a lovely group of people who've been coming together now for some weeks in various ways. We're not all physically together because we're a bit in lockdown here in France, and this is a serious lockdown. it's a bit easier just across the border. But can I just give a shout out to John Atkinson, who's working with us in 4SD on systems leadership, living systems leadership. John just waving. Can I give a real big shout out to Twee and Glenn? Why am I giving a shout out to Twee? Because she's the one who looks after this whole process of communication, website, briefings, getting the videos done and so on. Catherine Deland, who might not be here because she's working just today with our colleagues in WHO. Catherine is a health advisor in our team. She's an international health lawyer and has been just fabulous on all the WHO relationships. Joe Colombano is here. He's an economist who works with us. He was just with me on the meeting that we had with the diplomats in New York. Joe, thank you for your fabulous briefing. Magali Mahdi might be here, who handles everything to do with our scheduling. She's waving there. And she's also connecting us with many NGOs. Saber Moumen, who's at the moment in the middle of Ramadan. He's from Tunisia. He runs all our administration, keeps things going. Julien Delamontex, who's just interpreting the guidance from the French government in his commune, just not far from here in Flen, and is currently dealing with the challenge of masking. Julian, I don't know whether you were there. And then Florence Lasbenz, who's kindly working here next to me, partner in 4SD, and my wife, who is working on all the issues to do with bringing in your questions. And in a minute, we will go through them quite fast this time because I think there's a lot. And just who's connected today? Well, we've got colleagues from Canada. I was just listening to the health minister from Canada's talking in this briefing with the Canadian representative at the UN. Really lovely presentation on some of the challenges of COVID and indeed the international issues around COVID and what it means. I just would love to once again give a shout out to our colleague Abdoulaye Kar from Senegal. Lovely you're here. We've got Rajan here from Kathmandu, Nepal. Actually, Samaria is here from Canada. I should have said that. And then we got Yvonne from Kenya. Thank you for joining. People from all over Switzerland. People from France. Thank you for joining us as well. Norway, Christina, thank you very much for being with us. And colleagues from the United States and from the UK. Just give a shout out to Peter Scott Bowden from the World Food Programme, who's been working a lot with me. Can I have a really big thank you to two young people who volunteered to do a write-up of this call. I hope you find that fun, and please stay connected to us because it's by sharing and making sense and getting these ideas out that really matters. Do you know, I've just been talking to a lot of people involved in the UK coming out of lockdown and sharing some of our principles, and they say, yeah, these make sense. And you realize that actually what we're talking about does have meaning to governments. It does have meaning to trades unions. It does have meaning to businesses. It does have meaning to universities and schools. So thank you. I'd like to greet Lucky Aziken, a Nigerian optometrist, founder and CEO of Vision Caregivers International Initiative. That's a frontline non-profit organization working on eye health, health education and community development. Lucky is one of the young people doing a write-up of this call. Lucky, I don't know where you are. If you're on the video, then I'd love to greet you. If not, if you're listening, right? Yes, I can see where you are, Lucky. I can see your picture, and you've got a COVID picture on your thing there. Lovely to see you here. Jasmine Burton is CEO, founder, and executive director of Wish for Wash. That means she's dealing with innovation on water and sanitation for health, and she's doing research pilots in Kenya, Zambia, Uganda, Ethiopia, and refugee communities in Atlanta in the USA. She's got a human-centered design and gender equity lens, just the kind of stuff that we really like to feature in these broadcasts, because what COVID is doing is just giving us fantastic opportunities to share ways of making a difference, often in very, very low income settings. And now we're going to hear from Georgina. I'm just going to answer Georgina's question. Georgina writes, can you talk through a mask? The answer is absolutely. When we're wearing masks, not quite as fancy as this, when we're doing operations in an operating theatre, we have to talk to each other. We can't do this. Oh, Mr. Nabarro, how's your operation going? You can't talk like that because you're completely destroying the sterility. So you have to have your mask on. And sometimes you have to have goggles on and a visor, and of course you have your head protected. So yes, you can talk through a mask. And I actually think we all need to get into practice of wearing masks, talking masks, and trying very hard not to get the mask slipping when you talk. It's all about the straps, by the way. But we need to be getting used to doing this, because in many countries from now on, face protection in public is going to become the norm. It's going to become the norm, particularly when you're on public transport. So get used to it. And Georgia Rian, I think I've demonstrated talking through a mask, but I'm going to take it off because I want to be clear, and you know, that's my excuse. But yeah, I can go on doing it, and it's actually slightly easier with the kind of masks that we use for medical procedures. They are a little bit sort of lighter. They look a bit odd, and I'm quite used to this. And remember, we're all going to learn to smile better with our eyes. It's going to become a way of communication. So this is something we're all going to learn, talking with our eyes. But yeah, there's some people who don't like wearing masks because they feel that it loses their beauty. But as I say, we'll get used to it. So first question, thank you. What can we learn from countries like Vietnam or states like Kerala that have taken early decisive action? How could they do this when richer countries and states have found it harder? Well, I think you're going to see in more and more newspapers and more magazines a lot of interesting debate about why it was that some countries were able to move quicker than others. Originally, when it was thought that it was just East Asian countries that were able to react quickly when COVID arrived, people said, oh, well, it's because they're political regimes. You know, they've got governments that control the people. And when they say, stop being close up together and physically distant, then that's what happened. And so people said, well, China can do it because they are strong and tough. But you know, my friend Bruce Aylward, who went to China in February and studied what was going on, he said, no, I went with one idea and I came back with another. I found all over China, people told me they knew that they had to physically distance. They knew that they had to mask. They knew that they had to shelter their older people. They knew that when an outbreak developed, it would be shut down fast because that's what they had come to understand. It was the people who led and government supported. Of course, not everybody believes it. So we go to South Korea, we go to Singapore, same thing. Go to Vietnam, very much the same thing. Go to Kerala in southern India, again the same thing, and slightly different from some other states in India. Go to Sweden, same thing. Government has basically not imposed rigorous lockdowns and said the people are actually doing it themselves. So I think what we learn is it's all about people. People. And I think that we're going to find more and more that people will make the change. Question 2. We're getting growing coverage of children with inflammation issues, some several weeks after initial infection. Is there any guidance on this from WHO? This is from Scott Knox. Scott, greetings. Gosh, I hope you got my email. I didn't find out whether you got it. I sent it. I hope it's not your spam. Anyway, Scott, it's great that you're here. The answer is we are finding more and more out about this virus all the time. It's not a simple virus. It's not just one single illness. Many people with COVID are getting long-term tiredness. We had a thing over the weekend about that from our friend Paul Garner, published in the British Medical Journal. We're finding some children get inflammation and it actually makes them quite ill. It's not common. But we're finding some people get kidney issues. So, yeah, I don't think there is a lot of material on this. It's just beginning to come out. The World Health Organization, I'll tell you what they've done. They've noted it. They're studying it. They're trying to understand it. They're trying to assess the severity, and they're not sure what this means for guidance on children and COVID. As you say, as you know, right now, the feeling is that children, on the whole, don't get it in anything like the same way as adults do. But yes, you're right, Scott, this is an issue. Thank you for reminding me. And what I'll do is I'll do some more work on this. I'll talk to colleagues to find out whether I get any more details. And because we're in email contact, I'll write to you. Next question, any insights for community responses in Africa? What opportunities do I see? Abdullah, merci beaucoup pour cette question. I just want to say that my experience is that in African nations, if you ask communities to take the lead on the behavior change will work. When we were doing Ebola, as you know, in Liberia, we didn't say to the communities we were working with, we want you to do 1, 2, 3, 4, because that's our instruction. We said, here's the issue. Ebola is transmitted through what happens, close body contact with people who are sick. And we said, you work out how you're going to deal with it. It was dramatic. Within weeks, we had communities just doing wholesale change of behavior. So the insight on community responses in Africa is entirely about sharing the issues with them, sharing the principles that I described with them, and then watching them make their own choices, develop their own way of looking after it. We will ask them to invite us back after a week or two so that we can comment on it and we could possibly offer some suggestions, but also we will learn from them. And then we will be able to take what they've told us to other places, as we're finding on, for example, masking, where we're learning such a lot, or hand washing techniques that can be done, tiny bits of water, and so on. So Abdullah Khan, it's all about learning from the communities. And I look forward to discussing with you. I'm so glad you're on this call so that we can learn more about this. Question 4, people recover from COVID-19, can they be reinfected? If not, then we may need to get the whole world vaccinated. We may not need to get the whole world vaccinated. Can I just say, Dr. Lucky Azikin, one of the things that we've noticed is that actually when COVID goes into a community, at the beginning at least, not many people get infected. So we mustn't assume that there is a huge amount of infection that happens super fast. Even now, even though there's an awful lot of COVID in the world, we know there's at least 4 million people with COVID. There's probably many, 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 many more because they're not being tested. But that's a tiny fraction of the world population. So that idea that you could actually rely on natural immunity, what some people call herd immunity, it's been a great idea. And it was actually at the heart of the initial response in some countries. It's unfortunately not going, at least at the beginning, to help us. So I'm not sure we can rely on herd immunity, but I do believe also that we still don't know enough about whether or not people can be reinfected after they've had COVID. There was a lot of data from Republic of Korea, that's South Korea, recently that suggested that there were second infections in people who've been infected. Were they new infections or were they virus that had been hiding in the body that came back? We just did not know. So we have to actually wait a bit to get answers to your questions, Lucky. Number 1, can they be reinfected? Not sure. I'm hopeful not. Number 2, is there a lot of natural immunity in the community after the outbreak has started? Not much. At the moment, early data suggests that it's really only those who've got mild symptoms or severe symptoms who've got the disease. But watch this space. In a month's time, I may be saying something slightly different because there's new data coming in all the time. So stay in touch with us, Lucky Azikin, and we'll try to get back to you. Question 5, the risk is not symmetric across communities. Vulnerable populations and people in vulnerable circumstances are going to need greater attention, investment, and care. Absolutely. Absolutely. There are people who are much more vulnerable. They need to be shielded. They need to be looked after. They need to be cared for. Of course, you've got to listen to them. Please, let's not do it. Older people all over the world. Southeast Asia, I'm hearing from Koreans and others, they're saying, we treat our old people like the heroes. We look after them especially. So yeah, they need much, much more. And the countries, community leaders and businesses need to be thinking about this inequality, what you call asymmetric risk. Dr. Kath, absolutely. And how to tailor responses appropriately. Answer, you work out with people how they would like their risk to be handled. Some people will not want to be mollycoddled, if you don't mind that expression, i.e. put in mothballs. We have to work out with them. So how's the best way to go about this? 1, you need the data on the risk, which WHO can help with. Number 2, you need to talk to people about that risk. But There's a special point here. Supposing you're working in an industry where the risk is high, answer, we've got to support you to get your working conditions improved. People working in meat processing have a terribly high risk of COVID, and we need to be working with the businesses that are involved in meat to say, come on, let's sort it out. Otherwise, we're sending people to work in unsafe conditions, COVID unsafe conditions. You're not COVID ready if you do that. Question 6, is there a model of temporary living where people with COVID-19 can be isolated, but in a real shared living system where everyone there has COVID-19 and they help each other heal? So mostly at the moment, we're saying actually isolation means isolation. We're still not sure if you put people together, you actually make the situation worse by increasing the level of circulating virus. So at the moment, Catherine, it is individual, but I think that may well be looked at in future because we're getting more and more data about what happens in households when you have household members together and they're not refusing, they refuse to be separated. And we're seeing that that actually really helps. But that's a great, great idea for us to pursue, Catherine. And I will go on talking with you and others about it, whether or not collective isolation is a good idea. In the situation where people are in quarantine, for example, in a ship, okay? You've got some people who've got COVID, some people not, but you're putting them all in the same space. That's disastrous because the non-COVIDs get infected by the COVIDs. So what you're really suggesting is that if you've got an all COVID community, can you actually put them together? And as I said, a bit of nervousness about the amount of virus that's going to be moving around and whether or not that's going to make some people get a worse disease than others because of viral load. But let's see and let's find out. And I'll keep checking in with you on that one. Question 7. We're working with people who are living with HIV in several countries to see what their challenges and ways of working with COVID are. What do you think people may be able to learn from the large number of people living with HIV and from others who've had direct experience of pandemics, especially in resource-constrained settings? And this is from Corrine Squire. Thank you, Corrine. First of all, what is COVID like in communities affected by HIV? I don't know. My colleagues in South Africa who are watching a COVID outbreak enlarge in that country, and there's also an awful lot of lots in COVID in South Africa, there's also a fair amount of HIV there as well, are looking out very much with the basic hypothesis that if you've got HIV, your COVID is likely to be worse, and they're checking it up. And I'll make sure that in a future briefing, if we've got any data on that, we'll share it with you. I expect that will come out fairly soon. We just need to get the data collected on COVID status in people with HIV. My current, as I said, hypothesis is it's going to be worse. And we need to be working with people with HIV on how they can be COVID ready. But I think direct experience of pandemics in resource-constrained settings is really, really important, especially what we can learn from Ebola, particularly on responses to Ebola. COVID and Ebola are different. It's an outbreak, by the way, Ebola. But I think there's an awful lot on the basic approaches to involving communities that we can build up on. Question 8, please can you share with us resources on network management? This is from Iman Ahmed. And I think, Iman, I know that you're interested in this. I think we've had a little bit of an exchange about it before. You're concerned about rumors, finger pointing, stigmatization, divisions during crisis, blaming, scapegoating, all that stuff that happens when there's a crisis. And we're seeing a lot of that at the moment at lots of different levels. So yeah, in 4SD, our little organization, we have some people who are specialists in how to run and manage networks. I mean, a network itself is an organic thing, but we have got people who know how to actually help shape the way in which networks behave. And Iman, I know that you are interested in that. And one of the things that we will do, and I'm just going to look sideways to my right, one of the things that we will do is to find a way to connect you with one of our people who's been in 4SD, who's a really fabulous network person who I met actually. Do you know how I met her? I won't mention her name because I think that's a bit confidential, but I would just say, we have a person who did it. I met this great person who's just fabulous when we were working together on avian influenza in East Asia. in 2005, 2006. And she stayed connected with us over all the years, and we will make sure that we connect you with her. Thank you, Emma, very, very much indeed. Kathy Meadows, thank you very much for this message. You're in Canada, I know. We're hearing that there are better masks than N95 available in the construction industry. Do I know anything about this? I've always believed the N95 masks have sufficiently good particle filtration capacity that they really can protect against COVID. But yes, there are finer mesh masks available. I can't remember their names. And so, Kathy, on that one, I'm going to ask you to make sure that Kathy Matthews, that we know how to get hold of you. That's something we have to deal with in order to give you advice on getting a higher grade. But for us, N95s are fine. I can see you there, Kathy. I just took my eyes down. So just make sure that we know how to reach you. Could you make sure that either you send us an email at contact@4sd.info, I-N-F-O, contact@4sd.info, and we will do that. Next question 10, what can we do now to help people to build natural immunity and optimize health during this CV-19 isolation? Again, from Catherine Cunning. Catherine, it's really correct what you say. And I want to stress it, and you and I think, might have discussed it. It's about good nutrition, sleep, looking after what's coming into your body in terms of things that are good for it, being encouraged, and not things that are bad for it. And it's about also our mental well-being. Perhaps our biggest anxiety for people during CV-19 related isolation is that they are getting really stressed, and I actually want anything that you can advise on ways in which we can reduce social isolation while promoting physical distancing. Now more than ever, we need to connect. We need to connect with people who are perhaps saying, I don't want your help. I don't need your help. I'm all right. But we know that they're actually very stressed. So anything you can do to help us with this. Question 11, more men than women die from COVID. Can you address the genetic influence of estrogen and the immune system, and also the influences of enzyme H2 levels in the body? This is from Trey. Well, Trey, you may have heard that there is currently a hypothesis that it is the estrogen, and in fact, more generally, the female sex hormones that are protecting women. I don't know enough about H2, and so I need to look that one up. But yes, there is work underway on whether or not estrogen therapy, I hate to say the word, but supplementation, I should probably say, may reduce the risk to men. I don't have the answers, but the trials are underway. So Trey, if we hear anything, please come back to us in a couple of weeks' time and ask the question again. We'll be on the lookout, and please use the contact at 4sd.info. Question 12. How can we evaluate the impact of COVID disrupting existing services like HIV, immunization campaigns, malaria control? How do I expect countries to recover? This is from Ilhan Unsafi from Morocco. It's a real problem. We know that basic health services are being disrupted. As you said, malaria, as you said, HIV, as you said, immunization. I'll add a few more. Cancer, routine services for pregnant women, like antenatal care and the like, they're all being disrupted. You have to be able to find a way to protect health services for the population as a whole and not let them be completely diverted by COVID. And it's a challenge. We love doing these open briefings. We like to hear from you as to what you think about them. Thank you very much for joining them. Catherine, I agree with you that feminine leadership is absolutely key. And what I'm going to do now is, Catherine, ask you if you could open up your mic and just give you half a minute. Then I'm going to go, if I can find him, to Abdullah Kar. I'd just like you to say a word as well. Just make your point now. Just you're on and you're live.
Oh, wow. Okay. Wasn't expected. Well, all I want to say is that this kind of virtual discussion is essential. And I've been actually trying to get on for weeks. So for whatever reason, I haven't been, but I just want to say a word of gratitude. I do work with Eurovision News and Events, and David and I have been working on a series called Combating COVID with Compassion. So it's thrilling to see that really the narrative is all about people, and living in California, being governed by Gavin Newsom. I should say I'm very thrilled with our leadership and I'm grateful for it. And I'm actually writing a piece about what we can do to be COVID ready, because as David is now reinforced and has reinforced throughout, we're going to have to be living with this. So
Thank you,
how
Kathy.
create.
Thank you for what you're doing.
Thank you.
Yours. Abdoulaye Carr, bienvenue. Si tu veux parler en anglais, ton mic est ouvert.
Okay. Okay. Merci. Thank you very much. Hello, David. I'm very, very happy to hear you. It was really, really interesting. It's my first time, but really, really very lots of insights. My word from Senegal is that what a challenge, COVID. I mean, you see so many social, economic, cultural, religious challenges around COVID, and I mean, here in Senegal, people are talking about how do we live with COVID. So the after COVID will really bring us, I mean, to a shift. I think a shift in the way of planning, a shift in our approaches regarding our systems, education, health, religious, in fact, because the mosques are locked, you see, and there have been so many pressure on the president to unlock the mosques.
Yes.
And you know, we are talking about a health issue and economic issues, but this religious issue took a big place.
Yeah.
It means a lot. I mean, there is a very, very holistic analysis we have to do, because tomorrow will be another day for me.
Yeah.
So I will be very happy to change with you, to have a chat with you maybe
Let's
later,
do it.
because there are so many things to say in what is happening in Africa. And for nutrition also, we have been very agile, and we have some activities we have adapted at the community level, and I'll be happy to share with you.
Please. It's all about connecting things. You can't do things in individual pieces. I love the fact that you're talking about the importance of religion, whether it's Islam or Christianity or other religions, super important in your country. Thank you very much. With us, we will connect. Could I, Andre Hoffman, if you'd like to say a word, Andre, you're welcome to say one word, otherwise not.
Yes, no, I'm delighted. Thank you very much, David. This is, of course, a fascinating briefing. I think two things I'm learning here. One is that we do know very little. We can characterize certain of the symptoms, we can identify the virus, but we're discovering a new facet of that disease practically every day. I mean, this notion of it being a chest infection has long gone, and I think it's important that reality tells us that. Secondly, I cannot stop, but I cannot lose the opportunity to say that this has demonstrated the extreme fragility of our existing system. The fact that one single strand of RNA has succeeded in putting the entire Anthropocene civilization on its knees, the fact that we've been destroyed for 2 months, is quite a significant demonstration that we need to build resilience in our system. And we will build resilience if we are a bit more humble towards social and environmental issues. So David, I know you and I had an occasion to discuss this sort of thing before. Nature-based economy is the thing we should be focusing on the rebuild phase, especially now as it seems that, at least in our part of the world, the infection curve is flattening. Obviously, this is not going to last. The moment we start to deconfine, we will again spread virus to a certain level, but we seem to have been able to manage our transition so far. So it's now time to look at the root causes of this, and the root causes is this lack of respect from the world around us. And this is true for nutrition, this is true for health, this is true for nature.
Thank you very much, Andre. Andre has been really leading this effort to try to bring climate, nature, health, and development all together. And so it's a delight that you're here, Andre. He's quite also very experienced in the issue of pharmaceuticals and diagnostics. So the fact that you are leading on this is so important. We just have one more question. Can poor countries do test, trace, isolate, or is this only for developed economies? I believe they can. And if they can't, things won't work. It's going to be much harder perhaps because testing won't be available everywhere. But one of the things I've discussed with Andre is ways of actually improving access to very simple tests, like I was saying at the beginning. So it is our quest and our ambition to make that possible. Somebody has said, any further information on plant extracts on efficacy against COVID? I don't have anything on that, but I know there's a lot of work on it. And this is something for us to do some research for. And so here's our departing message for you. I was going to bring in a couple more people, but actually we are at our time limit. Sorry about that. But I can do better next time. I can stop earlier. And this is an experiment, inviting people to make comments, and we'll do more of it. Works beautifully. More questions and comments were coming in on the chat today. So here's what we say. Come to our next briefing to continue the conversation. And you'll recognize that technique. Those of you who like me, watch series and you just reach the end of a series and it's that very tantalizing point at the end. And you say, oh, well, I'll watch one more episode. So we're inviting you. Please come to our next episode and we will make it more exciting, more interesting, more stimulating, even than this one. Thanks again. Thanks to the team for everything. And most importantly, you are the leaders. Remember, I've said that before, but I'm going to say it again. You are the leaders. We all have the power to lead. It's not just the bosses. And in fact, what I've learned from some of you is that if you were the bosses, and I would say particularly the people who are not belonging to my sex, I think you would be doing a lot better. So to the women leaders among you, thank you very much indeed for all you're doing. And please keep it up and do it stronger, because it seems that some of the best COVID leaders of the world are not the men. Thanks a lot. Bye-bye. Just stay on for any post, we can obviously have little conversations. Have I got any grandchildren on today? I'm just looking quickly now. I think my daughter was on, but she's gone. There you are, Iman Ahmed. I was looking for you earlier. Nice to see you there. I've just unmuted you. Thank you very much for joining us. I will find a way to talk to you about how networks work. So Iman, thank you very much indeed for being there. Brilliant.
Please, thank you.
Thank you. And here is my daughter. And there is my grandson. And a lot of this is about our kids and our grandkids. He's not currently in the mood to stand in front of the camera and wave, but there he is.
I'm afraid.
During this period of COVID, he's become a real walker, a really, really ambitious walker. So thank you, Polly, and Sarah giving to Isaac. Oh, there you are. Yeah, he's there. He's called Isaac. Very, very nice. And he's my grandchild. I've got 4 grandchildren who are there, but Polly, in the midst of a very exciting project. So thank you very much indeed for being with us, Polly. I hope it's all right there. There you are. I hope all's going well. Yeah. And then Yvonne, if you're still on, yes. Is your network working where you are in Kenya? How are you getting on?
Yes. Yes. Can you hear me?
Yeah, beautifully, beautifully. How's life
Yes.
in your farm?
It's really beautiful, and I think people are getting back to work. And what I'll comment just really briefly is that it's that the masks are now like a normal, and it's now law that you have to wear the mask, and without the mask you can actually be arrested and fined or jailed for 6 months. But people are now taking that as normal.
I am impressed. I've always said that it's going to be necessary for people to get into the habit of wearing masks, at least when they're in public. If we're in a matatu or something like that, you have to have one. And I hope it's all right. But I know you've had a terrible, terrible challenge keeping your small business, your small agriculture business going because of the challenges in the food system. So don't hesitate to tell us what it's like, Yvonne, as it goes on. And thank you for keeping in touch with us. I just want to say,
thank you.
We are putting onto our Forestry website some sort of a window on life from Yvonne Otieno. She's founder and CEO of an agri-food processing company that's trying to set up an export business in dried fruit. And she's shared her experience in one of the reflections she prepared on her experience of making her company COVID ready. Yvonne, I'm a bit of a fan of yours, so thank you. Harriet Hadfield, did you have your hand up earlier?
Oui, tu es sûr parce que tu as le permis, Alex?
Oh, she's on the phone. Sorry about that.
C'est juste un...
Her hand up before. And then just Christina, thank you very much for joining from Oslo. I don't know where you are. You're in your flat or something.
No, actually, I'm at the ETH offices because starting Monday, we are allowed to be back. Norway allows 20 people reunion now. So we're back at the offices and you are not required to wear a mask in public. So in Norway, things are a little bit different than the other parts of the world.
Did you say you're wearing a mask in public or not?
No, not at all. You're not required at all. So Norway is a little bit different.
But I think that this is a reality, that different countries are working in their different ways. Thank you. Rojan, are you?
Yes, sir.
How are you? Namaste. Kosta hononchad.
I'm good, sir.
Bit late.
I'm good. As I said that we are going in a very terrible positions right now. Many people are coming through India since we have got open border.
Yes.
So having fragile health systems,
Yes.
limited capacity in terms of infrastructure, in terms of human resource. The things may be very critical in coming days.
Yeah.
Hope we will able to do our best to contain the disease. So hoping for the best.
I think it's time for us, you and I, to have another call. And tomorrow morning, my time, it'll be tomorrow afternoon, your time, I'll try and connect by Skype, okay? Thank you, Rojanji. Thank you very much.
Thank you, sir. Thank you, sir. Thank you, sir.
And so that's it. I love this last bit, and we're trying to make it longer. Carlos, how are you? I hope you're well. Georgina, I hope you're well. And I just want to say to Lucky Azikin, thank you very much for joining. And thank you for your question. And with that, I'm just going to tune out now, but we'll be running another one on Thursday. And I know for some... Hello? Who's that? Is that Lucky?
Let me tell the message. Let her be choosing. Yes.
Thank you. I hear you. Lucky, I hear you. Your internet is good enough for us to be connected.
I'm here, yes.
Very nice. Oh, there you are.
Yes.
You now. Thank you. And like you had to
yeah,
take the
that's
mask.
me.
There you go. Thank you.
Thank you too. It was a very interesting section.
Well, thank you for joining, and bring other friends in if you want to. You can just get them, you know, anybody can.
All right.
Thank you. And Sarah, nice to see you again. I'm so privileged. Lucky, thank you. Sarah, privileged.
All right. Thank you.
Thank you, Isaac, as well.
Thank you. Thank you. And Sarah, I saw you waving at Isaac. Thank you very much indeed. And with that, that's it. Bye-bye, everybody. Thank you. Thank you very much. Cheers.